Right, we're recording. I am joined by the incredible Dr. Hector Izquierdo from IVF Spain. Doctor, thank you so much for giving us some of your precious time this morning, because I know you're hugely busy in clinic. So to have this half an hour with you to pick your brains is amazing. So thank you.
Thank you a lot, Sarah, for inviting me to this conversation. For me, it's very important for my patient also to get information. I really appreciate what you're doing, asking some questions directly so they can get this information. So I'm the one to be taken.
Thank you. Today, I really wanted to pick your brains about eggs and about really understanding our bodies and eggs. And it's information that actually I wish I had sought years ago, long before my fertility journey even started, because I think actually if I'd understood my own body and how it worked, my fertility journey would have been a lot shorter because I would have looked after myself. Can you just take us right back to basics and just explain about how it works and about our eggs and how many and all that?
Of course. So the very first thing I want to say, and the most important as well, is that all women are born with all the eggs that are going to have their whole life. There is no possibilities to increase this number in their life. As a baby in your mother womb, you are producing those eggs that are going to be in your ovary. So after you have your first cycle with 13, 14, or 15, these hormones will regulate that you start having one egg, one other patients, 2 eggs released cycle so you can get pregnant. This number, I'm sad to say, that's not fair, cannot be changed, and it just goes down after every single period.
Wow, gosh. It's mind-blowing to think that a woman is born with all the eggs. Completely mind-blowing. And so when would you say these eggs are in their prime?
Well, that's the only thing that's really unfair, because we human as a species, we're trying to evolve, to have more things, to be able to educate ourselves, to be able to get better jobs, and that's going in the opposite direction than our bodies, because women are in the best reproductive age from 20 to 25, and at these ages they are not in the proper moment to assume the shore of being a mother. But it's really difficult and complex. So the moment when you are really prepared to be a mother, and really feel comfortable in the work, in the family, with a couple or alone, wherever your way may be, it's already not that late, but not the perfect moment. And that's really unfair.
That's very cruel. Children weren't even on my radar when I was in my 20s. It was only when I got to like 31, 32 that I thought, okay, I'm ready now. And by that point, it just wasn't working. So for a woman who wants to have a child and it's just not happening naturally, what does she do to understand and to work out how many eggs she's got left and how good those eggs are? What should she do?
Well, depending a lot on what a woman would like to do, but I really believe, and it's something I want to sensibilize all people around, is that we need to take care of this issue as soon as possible. I really believe as we give consultation to your kids or our children, telling them, let's go to school, let's go to university, let's formate, we should as well be in the possibility of giving information what to do regarding their fertility in the future. So as soon as I tell one of my daughters, hey, you should think what you want to do in the future, I should tell her as well, yeah, you know something, you may as well do something now to preserve your fertility in the future, because that's really important as well.
But what about for a woman who it's almost like what are her options if she's in her 30s? Like, what will her doctor do to tell her how good her eggs are or how many eggs she's got left? Because that's what everyone wants to know.
As the first thing, losing the fear and not be shy and go to a consultant. After you go there are 2 quick factors to know how around you are, or how good you are, how well prepared you are, how much time do you have left to say something. Those 2 things is one, a scan, and the second of them is the anti-Muller hormone. This anti-Müller hormone has been spoken a lot. I'm going to explain better what it is. In your ovaries, you have cells or structures that are called antral follicles. Those antral follicles are the follicles that in a cycle are able to produce an egg. These antral follicles produce estrogens under the influence from the follicle stimulant hormone, but they produce as well, without the stimulation from FSH or a follicle stimulant hormone, AMH. Therefore, if I see in blood the product of these antral follicles, I can also say how many of them are available indirectly. That's the AMH. The other thing is the scan, and the scan allows us to know how many follicles would this woman in this cycle with a proper stimulation mature that can turn into eggs that we can use in the fertility reproductive therapy. That's the two things we need to do. Regarding the AMH, independent from cycle day, you can do the test. With the antral follicle count, we always recommend to do it on the 3rd day of your cycle. That means having your period, and in the next 3 days, go into the gynecologist and tell him, or the specialist or the scan assistant, and tell them, I want to have a look on my ovaries and to see how many eggs we have. There are some complementary laboratories that we can do in order to see how can you react to a stimulation, but that's way further. I believe for the first consultation, what I need to know, where am I standing at this moment, is antral follicle count, through an ultrasound, and AMH. With that information, I can make some planning, me or any specialist.
So is that test, it's essentially telling you as the doctor how many eggs that woman has left?
How good the process can go, because that's not a one-to-one number. It doesn't mean AMH from 2 equal 10 eggs. It's not directly proportional, but it shows you a bit how suitable are you for a process in good means.
Because we've had a lot of queries before from women who have said, if I have a very low AMH level, can I still get pregnant?
Well, that depends on 3 factors. First of them being the age. A woman who has a low AMH, therefore a low ovarian reserve, but in the early 30s, have much more higher successful chances than a woman who's 40 with a really decreased AMH. How come? Because one thing is having a low ovarian reserve and a low AMH, and the other thing is the quality of the eggs that are inside. The younger the woman, the best the quality. Therefore, the cue is not only to produce eggs. The other important factor is those eggs being able to fertilize and to produce an embryo that's going to be genetically healthy in order to proceed into a pregnancy. Therefore, a woman in the early 30s with a really decreased AMH and ovarian reserve, if she produces an egg that produces an embryo, the chances of this embryo being genetically healthy and therefore being able of making her a mother are much higher than a woman with N30s with a low AMH and a worse overall quality.
And when it comes to egg quality, can you improve the quality of your eggs? Or is it that by a healthy lifestyle, you're simply reducing the risk of the quality going down?
I always use a metaphor that's really nice, and it's also really true. Women are in their reproductive situation more like a diamond's mine. You have your diamonds there. The only thing you can do is get them out. You cannot increase them, you cannot make more, you can make them for better quality. Those are there, and the only thing we can do as specialists is grab them and take them to the surface. Okay? Other than men are chocolate factories who produce a lot, it stops, goes again with no quality. That's not that important. Yours is what's really important here. Therefore, there's nothing I can do to change the quality underlying on the ovaries. What I can do is to improve the process of retrieving them in the hope that after improving that, we might as well have more and those more have perhaps one from better quality, but the quality cannot be changed, or we have not been at this moment that can better the quality of the eggs.
But changing your lifestyle, having a healthy lifestyle, not smoking, not drinking, that simply stops the quality diminishing.
Yeah, that's the thing. As the same way we cannot stop aging from coming to us, although we try, we cannot stop the ovaries from aging as well. Naturally, not smoking, eating healthy, making sport, those things, what they do is something different. They make the ovary better blood supplied. That means that the hormones that are going to the ovary, the tissue that's going to be there, it's going to be more reactive. It's going to be more proper to be stimulated. But changing the quality from the tissue in the ovary, something we cannot do. Not at the moment. In the future, we'll see. We have a lot of hope in stem cells. We, in this case, for example, do PRP, platelet-rich plasma, in order to have some growing factors that may as well increase the answer rate, those ovaries on those extra stimulation. But changing the genetic material and the situation of the eggs is something we can still do.
And what sort of advice do you give your patients before they start treatment? Because every woman, and every man wants, we want those eggs we want to give you the best eggs possible so that you can work your magic. And a woman wants to feel like she's doing everything she can herself to produce a better result. What can she be doing herself?
A lot. There are many studies that had proof that small things make a huge difference. First of them, women with a bit of overweight. Reducing 5 to 10% of your weight, if you're overweighted, increases the chances of succeeding in a stimulation in 20 to 30%. Wow. As simple as that. Quitting with smoking increases the chances of succeeding as well. Eating vegetables and fruits increases the chances of acquiring or obtaining better eggs by the egg retrieval. With a simple thing is reducing oxidative stress. That's something that's been taught a lot nowadays, and it's not other than when we are working, walking, eating, and doing everything what we do every day, we produce oxidative stress. We oxidate. Like iron on the street, the same happens to our bodies. Our body needs to be able to take all this iron or this oxide that's being produced and take it out of our bodies. If we eat better and have better, healthier habits, what we do is letting our body have less pressure, taking care of this oxidative stress that we might produce.
And that's absolutely fascinating. And how long would you advise? I mean, obviously, the longer the better to do the things that you've said. But is there a kind of is it a 3-month process? Can you make a change within 3 months?
Yeah, of course you can. Of course you can. And everything you do, it's your body is going to be thankful for. There are many studies for the most for cigarette, and stopping smoking for 3 months. It's the same as not having smoking for 2 years. That's really good. Once you stopped, the biggest effect is right away. The longer you make it, the more time you give your body to renew and get better. But alone stopping, alone taking decision is also good. The first step is the harder and also the most important.
Do you also recommend like supplements and things to your patients? Because that's another question we get asked all the time. What can I be taking?
Of course, and that's also not a mystery. We do all the same. Vitamin Q10 is very good. DHEA, it's been proven to be helpful. Although, and also in patients that doesn't have a diminished DHEA level, those patients with normal DHEA level profit as well from DHEA substitution. Vitamin D, omega-3, fatty acids from fish, it's also good, and melatonin. Those are the most proven things to be helpful in the fertility process.
That's amazing. That is, when I started my fertility journey, I didn't know any of that. I think I picked up like a bottle of multivitamins. I thought, oh, well, that will do. It's so just going back then. So you're saying that making those lifestyle changes aren't going to improve the quality of your eggs, but they will improve. Is it almost like the receptivity of your body to what it is that's going to be happening?
There you go. They make you more suitable for stimulation. They make your body more prepared to give you the best of it.
Yes. And because another question we get asked a lot is, just before transfer, women are like, is there anything I can do just leading up to transfer to make my endometriums just perfect and so welcoming that the embryo will just have to stick? Is there anything else? Is there another something else you can throw in the pot, or were those changes enough?
Really simple things that got forgotten very fast. Prolactin level is something that's forgotten a lot. Not a lot of people talk about that. Prolactin is a really important factor in reproductive medicine and in successful transfers. Levels of prolactin around or under 9 nanograms per milliliter show to increase the chances of a transfer.
Did you say prolactin?
Prolactin, yeah.
What's that then?
Prolactin is an hormone that's produced by the hypophysis as well, like the FSH in your body, and it's the hormone that allows women to breastfeed after the delivery. That woman being increased may have an effect in your endometrial lining or in your reproductive health, that higher levels of prolactin has been associated to decreases success rates and transfers.
And is that something that your doctor gives you? That's not something you take yourself?
Something your body produces itself. Mm-hmm. It's an hormone, as I told you, like the thyroids, like the estrogens, like the progesterone. You produce yourself prolactin. And what we doctors need to do is to make a test in your blood to see the levels from that. And depending on the results, giving you therapy to decrease these levels. Once those levels are decreased, you have a better answer. They should be around or under 9 nanograms per milliliter.
Okay, and then I'm so sorry, I'm sort of steering away the sort of, I know we were just talking about eggs, but this is, now I've got you, I just want to like, and you know, so once you've got yourself ready and you've done the test that your doctor's just said, what about this testing the window of optimum implantation? Do you suggest that for most patients?
To resume everything, things that are important for a transfer: prolactin, as I told you before, thyroids, get forgotten a lot, and it's super important and so easy to therapy. Women having a TSH level above 2 have less chance of getting pregnant, and that just means taking a pill once a day in the morning. So easy at that, or so easily forget. Third thing, antibodies against thyroids, anti-TPO and anti-TG. Those being increased reduces the chances of a successful transfer. And that's also so easy to therapy. You don't need to get prednisone on your therapy. Easy to do, easy to work with. Third factor, endometrial receptivity window. We now know that the language in between the endometrial lining and the embryo must be perfect. If they cannot read each other, if they cannot understand each other, therefore it's not going to be an implantation or an annidation from the baby. Testing the endometrial lining and testing the implantation window help women to get pregnant. That's a really simple test due to a biopsy. And with that, we can say if your endometrial lining is at the moment with the amount of progesterone that you've been taking for 5 days at the proper moment to receive an embryo, too late or too early. Therefore, displacing this window in the proper way for the next transfer is going to help you getting pregnant. Fourth factor, immunity in your endometrial lining. Get forgotten a lot. Not a lot of people know about that. It's been some misleading information because many people talk about immune system in blood, but we need to understand that our immune system is not one. We have several organs. In all of these organs, my immune system works differently. Therefore, testing my immunity in my blood tells me nothing about the status in my mouth, in my stomach, in my endometrial lining, or my eyes. Therefore, with a biopsy in the endometrial lining, we can know as well how the NK cells, the lymphocytes, the Th1, Th2 profile, how are they working? Am I going to be good to receive a baby? I've been told immune system is bad for the pregnancy. And that's a lie. We need it. We just need it in the natural equilibrium, and that's easy to substitute with many things: intralipids, fat acids, granulocyte, orbitrol, tacrolimus, prednisone. Those all are not just things that we need to do. We need to know in which status is every single woman, and therefore attach this therapy and adapt the therapy to her.
Do you happen to have like literature with these 4 points on? So when someone comes to you, do you have this written down for them to sort of almost like check off?
Well, that's something I believe it's really the work of the physician. We need to talk to our patients.
Yeah.
We cannot expect a woman coming to me and telling me what I need to hear.
Yeah. Yes.
I need to go to your story. Women are like books. All information is there. I just need to open you. If you're not open to me, if I'm not successful at letting you open to me, therefore I'm the problem. If you're not feeling comfortable, if you don't feel that you can tell me everything I need to know, there's a problem. Giving you a test where you can just make crosses and therefore have some information, that's not what we need.
No, absolutely. I think what's really, really lovely is for like just talking to you now and hearing you say, well, look, these are the things that are going to help you. These are the things we do. I think I would love to have had that when I started my journey, because I went in completely blind. I didn't ask questions. I just went for it. And I think actually, had I understood more about the process and the things you were doing, I think I would have felt more in control, and I would have felt just like I understood what was happening to my body a bit more.
What I think is the most important in my consultation is empowering my patients.
Yeah.
For me, the whole school in medicine, you coming to the doctor telling you what you need to do, that needs to be over. My major purpose as a physician is for my patients to be able to make decisions herself. Yeah. If I haven't succeeded in giving her any information that she might need to make the right decision, then I failed. I don't need to make decisions for you. You need to have the information for you to make your own decisions, because not all the things are needed. Not everything is for everyone, but you need to have all the information to make your decisions.
You're a great doctor. I just want to, and I've got to be very careful because I know I've had some internet issues today, and I don't want to lose you. So I want to, I just want to sort of wrap up by summarizing what we've spoken about. So, so basically, if a woman now is just watching this who hasn't started fertility treatment yet, she's in her early to mid 30s, let's say, and is worrying that, oh my, I don't know if I'm going to get pregnant. I don't know if I've got enough eggs left. She should go to her doctor, and she should have, you're saying that it's the AMH test. There are tests that you do to find out where she is and what her chances are. And basically you were saying that in terms of quality, you can't improve quality, but you can reduce the risk of the quality dropping.
Yeah.
These are all, yeah, sorry.
And another very important thing for me is that since nature is not fair to you women, and I'm a 12 feminist, you need to put yourself in the first place. Therefore, waiting for Mr. Right or Mrs. Right in order to go there where I need to go, it's not proper anymore. I believe in the world we're living at this moment, women should be empowered from the very beginning and knowing that they need to care for themselves. Therefore, if you're in the early 30s and you think you're not ready because you would like to have someone with you, then stop thinking in the future and prepare yourself now. Because this person that might come in the future may still have chances, but you're not anymore. And then you'll be confronted with the situation when you have to resignate to your part and take into account this other part that came after. So if there's some hesitation, if you think you're not prepared because you want to do something else, then let some physician, a clinic, some specialist help you to protect your fertility in the future. The time is going, you're losing time, but just if you don't have a safe. If you have a safe, if you have some extra retrieve or preserved, then you can just do whatever you want with your life. You can keep on your traveling, you can keep on your working, you can keep developing in other aspects, but don't let it back. Don't forget it. Try to think in the future and to be prepared.
I just wish I had had someone like you talk to me a very long time ago. I would have definitely not smoked enough or smoked so much or drunk so much in my youth, that's for sure. Talking to you today has been so utterly wonderful. And I know you have a clinic to get back to, but I would love to be able to talk to you again in the future about other topics as well, if that would be okay.
Be my guest every time. You know how to contact us, and our department for international assistance is always open to generate these new chats and these new conversations, because it's really important to get information in open spaces like this where everyone can access to this, what has been told. It's really important. Not all the women can lose the shy and the fear of going to the doctor. There's still some taboo there. Going to a doctor or talking about fertility, what he's going to think about me, if he's going to be funny, what's he going to think if I tell him I want to do this alone, if I have a couple that's a girl, to lose all this shy, to lose all this fear. It's really complicated in the first instance with a doctor. Those spaces that you are offering right now make these people more encouraged and let them know, okay, I'm not alone. First of all. Second of all, there's people there offering me information. And third, I should get help. And I really appreciate what you do. And therefore, if I can help with something, please let me know.
Thank you so much. Lovely. Honestly, I really, yeah, I will be sharing this and yes, once again, thank you for your time.
I'm very pleased to help you.